Hello class, my name is Elvis Dingle. My capstone topic is catheter-associated infection. My rationale for deciding on this topic stems from the fact that it is one of the hand-on skill procedures nurses perform on the floor. The use of this procedure has lots of benefits, but the health problem associated with its use remains one of the major problems in the health sector and the focus of this presentation. Having that in mind, the objective of this presentation is to define the scope of catheter-associated infection, offer better communication on the need to solve associated health issues, draw a connection between indwelling catheter and increased infections. Finally, to explore the use of sanction-based catheter in the management of healthcare-associated infection. The problems associated by the use of catheter continue to increase. According to one of the literature reviews, approximately 16% of all patients in the hospital will be placed on indwelling urinary catheter. 20% of the patients with a ventricular drain catheter. Many of these patients end up developing infection associated with catheterization. Urinary tract infection, for instance, is often related with indwelling catheter. Sepsis with IV catheterization. As an elementary requirement of the plan, practicing nurses be educated using evidence-based practice like the highest level of hygiene. The patient should be sensitized to the need to accept the sanction-based catheter changes, which is safer and effective in the management of healthcare-associated infection. Catheter-associated infections are on the rise in the hospital patient. The lack of proper adherence to evidence-based practices is the main risk factor for the increasing health-associated infection. The introduction of sanction-based catheter will reduce the rate of catheter-associated infection among hospitalized patients. The course of managing healthcare-associated infection will be easy to follow as long as there are evidence-based practices that adhere to higher level of hygiene. The incorporation of evidence-based nursing practices bring the required cure to healthcare-associated infection prevention in the hospital settings.